After having a hysterectomy, one of the most important things you can do for your recovery is walking. Today, we're going to talk about how you should progress your walking, what it means to your body and during the recovery to increase your walking, and why it's so important. So from this video, you're going to have the steps to take to help your body recover and heal and feel more confident during this stage after your hysterectomy. Now, with a walking program, what's so important to know is how it affects your body. So walking has a lot of benefits, and not only helping your blood flow and circulation, that lymphatic system that helps drain and bring in all the good stuff that needs to help your body heal and recover after a surgery, but also the importance of how walking can impact your digestive system. We worry sometimes about constipation and going to the bathroom after a hysterectomy, but doing walking will also help stimulate your digestive tract in order to help that be a little more comfortable and prevent constipation, which is what you don't want after a hysterectomy. So we know there's a lot of benefits to increase your walking, but how do you know when to start? Well, you really want to listen to your body and your symptoms of having bleeding, increased pain, especially by your incision or your pelvic area, having more pelvic pain or pressure or discomfort. That way you want to make sure you're resting enough in order to help your body heal and recover. But walking on flat terrain and walking around your house, not doing house chores like vacuuming or doing anything strenuous, but just walking around your neighborhood and even in your house for 10 to 15 minutes in that first week or two after your surgery can be very helpful. Now, notice how your body feels after you start doing this. You don't want to have that increased tension or pressure down in the abdominal area or pelvic area. You don't want to have any increased bleeding or anything that could be alarming. But if you're balancing out with how much you're walking and how you're feeling afterward, that's going to tell you a lot about what you can do and progress to in the next day. So in those first 2 weeks, that's when I do encourage clients to start getting some movement and some walking. Now, your doctor, you definitely want to listen to what they tell you, but they are going to encourage that walking happens as the first part of your recovery and exercise. Now, there is a difference between women that tend to use like a walking pad or use a treadmill versus walking outside. Walking outside or walking around your house on flat surfaces is actually better than using a walking pad or treadmill, only because this will put less strain and tension and allow for more support when you are walking on regular surfaces, not using a machine or a device. Now, if it's icy or snowy outside, you obviously aren't going to do a lot of walking outside at this time of year. But if you had a choice, just know that doing walking outside on flat surfaces is better if you have the option to. So how do you decide how to progress your walking? Well, you want to use either a watch, your phone, something that's going to track your steps. Think about what it was like before your surgery. Did you get winded? Did you get tired after 5,000 steps, after 1,000 steps, even after 300 steps? Whatever that is, what that baseline was before, if you're not quite sure, just go by time. Could you walk through a grocery store? Could you walk a block? Maybe you have a dog that you don't want to be walking right now because they can pull you and create a little extra tension there. Just walk without animals right now. But think about what you were doing before your surgery. And then now you have a gauge to increase week by week. So if you are tracking steps, that can be a good way, or tracking time, then you can measure week by week, are you making progress? It's good to maybe keep a diary, write this down, or put some notes in your phone, and just notice at what point did you start getting fatigued, did you get tired? Now, once you get to that point, I like to use a scale from 0 to 10. 10 being like very strenuous, you're pushing yourself a lot. It's very difficult. 0 being super easy. So on that scale, do you go to about a 6 or a 7 out of 10 is a good gauge for when to stop. I tell my clients now, you want to make sure that you are giving your body a little challenge week by week, especially if you're about 4 to 6 weeks post-op or you've seen your doctor already and they kind of give you that check to go to not have as many restrictions. That way you can start increasing your distance week after week. I've worked with women helping coach them along on this process, and some being nurses or being teachers where they have to be standing and they have to be upright and walking a lot during the day and they want to get back to work. So in this case, we are going to find that measuring that distance and also measuring the amount of time is going to be really important to get them to that point so they can go back to work too. Now, if you're doing any manual labor at your job, then you may want to consider going on light duty or finding an option, talking to them to see if you can have a little more rest time where you're sitting down, you're not straining yourself as much. But not to get off topic, walking is super important to help just get you back to those prior activities you were doing before. So in summary, you want to make sure that you're measuring, you're writing it down, either steps or your time that you're going walking, and you're increasing it week by week. Next, you want to start on flat surfaces. Don't do hills yet until you know that you can walk at least about 5,000 steps or so and you are able to progress and push yourself a little bit more. That's where you can start doing some more inclines. And then next, you want to choose outdoors versus a treadmill or a walking pad if you have the choice. It's not to say don't do the other one, but if you want a little less strain on your pelvic muscles and around your abdominal area and your whole pelvic girdle, then walking outside can be even better for you. I hope you found this helpful when it comes to increasing your walking and what a walking program looks like after a hysterectomy. If you want to improve your core strength and help your pelvic floor muscles really recover, which is super important to support your bladder and prevent any long-term strain after a hysterectomy, then you can download my free 5-minute pelvic floor and core reset guide that can be very helpful to teach you how to engage those muscles and use them before you go back to any other strenuous activity. Safe to do within the first 6 weeks after your surgery. So go ahead and click that link below if you want some more information. Thanks so much for watching, and join us in other videos on this channel all about hysterectomy recovery, and we'll see you again soon.